Hello. I'm going to go ahead and cover the chapter that I titled Lactose Intolerance, Fructose Intolerance, and Bacterial Overgrowth. So, what's happening in private practice, I think, is that a lot of gastroenterologists and certainly primary care doctors are not really thinking about lactose intolerance. It's not really a topic that's brought up in meetings. It's not exciting. Um, it's a common issue, but not commonly studied or talked about. But the problem is a lot of patients have that, and it's important to recognize. Unfortunately, I think what's going on is a lot of those patients are just being labeled irritable bowel syndrome and given the FODMAPs diet, which is avoid fermentable oligosaccharides, um, disaccharides, monosaccharides, and polyols. It's a complicated diet, and it's not really getting at what the actual problem is, I don't think. So in the world, 75% of patients will have lactose intolerance. 25% of white patients will have that problem. 33%, or about a third of Hispanics, 75% of blacks, and even more, higher percentage of Asians, perhaps as high as 90%. So it may be hard for the patient to recognize this, or some of them do recognize it, but don't really do anything about it. There is a 4-hour delay typically between the onset of, in between taking the lactose product and actually getting symptoms. Symptoms are bloating, diarrhea, gas. Those are the usual symptoms. Some abdominal cramping may occur as well. And it is proportional to the dose that the person has received or taken in. So the sweeter something is, like ice cream, I think it's more likely to be a problem, or cream sauce. Fettuccine Alfredo always comes to mind. But lactose, a lot of patients think, well, I don't drink milk, but some of them even get confused with the amount of fat in the milk. Well, I'm drinking the non-fat milk, so that's not the problem, they may think. But it really has to do with the lactose in the milk or the milk product. So milk products are oftentimes in salad dressings, mashed potatoes, bread, ice cream, pies, cakes, cream sauce, biscuits, pizza, which is a very common food, Mexican food, Italian food, and it seems to be more prevalent when you go to a restaurant. I think they use a lot of milk products there. Now, cheese, soft cheeses are more likely to have more lactose than hard cheeses, but still can be an issue. So a lot of people are, I think, afraid to admit that they have the problem because they think we're going to ask them not to take any of those types of products. And it may be that some physicians do that, but I don't think that's a very good approach because patients need the calcium and the nutrition that comes from milk products. So one can either take lactose-free products when they make lactose-free milk, or you can add lactate drops or tablets. And the tablets can be taken with your first bite of your meal, or the drops can be added to milk and shaken up, and overnight it will help dissolve or digest the lactose that's in the milk. It's the enzyme that you're adding that is lacking in the lining of the small intestine as you get older and in certain populations. Also, lactose intolerance is associated with some diseases that affect the small intestine, and celiac sprue always comes to mind there. So a patient that has celiac sprue may not only have just trouble with gluten products, but also lactose, and they commonly go hand in hand. They're associated. Um, Also, French restaurants and French meals oftentimes will contain cream sauce. At least that's the traditional French cooking. And that, of course, has lactose. So when you get the lactate tablets, when you get those, if you have this problem, then you want to get the 9,000 ones. Otherwise, you have to take 3 of the 3,000 ones, which you're going to lose money there. So typically, you may need 1 or 2 of the 9,000 unit tablets to take with your first bite of the meal, depending upon how much lactose you took in and how much uh, how much lactase, the enzyme, still remaining in your small intestine that you have in the lining of the small intestine. So you may have to figure out whether you only need 1 or do you need 2 of those. If you're taking the 3,000 unit, you may need 3 or 6, which is not very economical. But those tablets can help a lot. And you may decide, okay, I can tolerate this, but this is too much. I'm going to take it here. I'm not going to take it there. Or I'm only going to take it when I go out to eat, or all these things. Some people even use milk products to promote bowel movements when they're constipated. They'll use it like a treatment, and it works for them. So that's fine. Now I'm going to go ahead and move. Well, before I move on, I'm going to say we did, when I was in practice, we went ahead and got breath testing. And when we did that, we could test for lactose intolerance. We would give milk and then test with the breath tester to see if the patient produces hydrogen from breakdown of lactose in the colon, which is what happens by bacteria there. So we developed that capability, and we developed it for fructose, the sugar in fruit, and also for bacterial overgrowth. I'm going to talk a little bit about that now. So with fructose intolerance, if you drink a lot of high fructose sodas, Mountain Dew always comes to mind, but there are certainly others. And a lot of sodas have tried to get away from high fructose syrup, but it's still around. And if you do that, you may get symptoms, again, abdominal bloating, gas, diarrhea, after you consume a certain amount of fructose. It can be certainly fruit. If you eat a lot of fruit or drink a lot of fruit juice, then you may have a problem. So we developed a test we went ahead and used a test for that. And what we used was Coca-Cola to test for it. And you want to make sure your Coca-Cola has high fructose syrup, but it did, and we were able to detect that. There are other small sugars that can cause problems. Sorbitol is one of them. It is used sometimes in medications, particularly in feeding tubes. It is used as artificial sweetener. It is used in diabetic candy. And it can cause the same sort of thing, abdominal bloating, gas, diarrhea. So you have to watch out for sorbitol, and some people will be sensitive to that. In fact, I remember talking to a lady who worked at the checkout line at a grocery store, and she said her husband, we know what he has. He just drinks all this Mountain Dew, and he gets diarrhea and sits on the commode, a long period of time. He knows that, but he's not going to change. And she's just kind of, and she's a retired nurse, so it happens. There's another there's another sugar called sucralose, and this one can show up in desserts, candy, canned food, yogurt, cough drops, or lozenges. So this can also cause the same kind of GI symptomatology. And then I'm going to move on to bacterial overgrowth as the last part of this chapter I'm talking about. So bacterial overgrowth, a number of years ago, a seminal article came out that looked at patients and tested for bacterial overgrowth. And it turned out And there was a significant amount of patients who were labeled irritable bowel syndrome. And you have to appreciate there's no diagnostic test for irritable bowel syndrome. It's mostly having to do with eliminating other causes and taking a history that confirms the diagnosis. At any rate, a number of these irritable bowel syndrome patients turned out to have bacterial overgrowth. And by that, I mean too many bacteria in the small intestine. The colon has bacteria, that's how it's supposed to be, but not the small intestine. So the old way of testing for this was to put a tube down into the small intestine and aspirate fluid and then culture and figure out how many bacteria and whether there were bacteria in the small intestine. This was very tedious and difficult, and of course could be contaminated by placing the tube down through the GI tract and through the mouth. At any rate, needless to say, this test did not have too many volunteers patient-wise, and we were able to detect the problem with breath testing. We used a medicine, not a medicine, but a complex sugar called lactulose, and lactulose is also used as a medication for constipation. At any rate, we would give a dose of lactulose, and then we would do breath testing, and we could determine whether there was evidence of bacterial overgrowth. Now, part of the problem there was the sensitivity for finding bacterial overgrowth by breath testing was not 100%, and it was there was a significant number of patients who may have bacterial overgrowth, but the test would be negative. So the sensitivity was not really as good as what you would like in terms of picking up bacterial overgrowth. So that led to the empiric treatment. In other words, just treat the patient with antibiotics and see how they do. So patients then would go through a course of antibiotics to see how they did. And if they did well, then you would follow them along, and when they redeveloped the problems, you would retreat them. But it's always nice to know whether or not you have that diagnosis or not, and it helps with compliance from the physician and also the patient. So we did run the tests, and but we didn't necessarily withhold antibiotics if it was negative and the patient had symptoms, and we wanted to see if they would respond to antibiotics. The usual antibiotics there was a drug called Xifaxan, an antibiotic called Xifaxan, and also an antibiotic called Flagyl or metronidazole was commonly used. So that was bacterial overgrowth, and still remains an issue and really needs to be thought about. So anyway, with that, I'm going to go ahead and conclude that particular chapter.